Here in Canada, the Quebec government is asking the public to avoid going to hospital emergency rooms if they have a respiratory virus because ERs in the province are jamming up again with patients. The province's emergency rooms are currently at 121% capacity. Average occupancy rates in Quebec ERs have been above 100% every day since December 27th. The government is asking the public to take steps to avoid the transmission of respiratory viruses. The health department says people should stay home if they have a fever, and it's encouraging people to wear a mask if they have symptoms of a cold or flu. Dr. Christopher Labos joins me now. He's an epidemiologist and cardiologist. Dr. Labos, welcome. Thanks for being here.
Oh, thank you for having me.
Now, the Quebec government is trying to relieve overcrowded ERs in the province by asking patients to not go in unless absolutely critical. What are your thoughts on that?
Well, I mean, I certainly understand where they are coming from. A lot of problems that people go to the ER for probably could be managed in an outpatient setting. The problem is you sort of have to understand what people are dealing with in an era where a lot of people don't have a family doctor, in an era where it's actually very hard to get an appointment at a walk-in clinic. We keep calling them walk-in clinics, but you still have to actually make an appointment to be seen at one, and a lot of them are at full capacity. Plus, a lot of stuff is closed during the holidays. So for a lot of people, they go to the emergency room because they have no other alternative. And while it's true that a lot of stuff probably could be handled in an outpatient clinic setting, people are going to the emergency rooms because they don't know what else to do. And if you're sick, you want to get seen now, even if it is a quote unquote mild problem.
So is this just a Band-Aid solution, or can we expect great change from this?
Well, here's the thing. You could expand the outpatient services. You could have more of these emergency outpatient clinics. There are things that you could do to develop, but these things take time. They take resources. They take personnel. And those are a lot of the things we don't have in a very large supply these days. All governments are facing budgetary restraints. They're trying to cut back. There's a large, or there was up until recently, a large sort of issue between the government and the public sector unions in terms of the negotiating pay rises. So there's a lot of factors that go into this. And so it's going to make it hard to put a lot of these ideas in place. To some degree, we know what the solutions to these problems are. We need more of everything. It's just we often don't really have the resources to do it. And the big problem with hospital and ER overcrowding is not necessarily people showing up with minor problems. It's if you have a lot of people that are in hospital when they don't really need to be, when they would be better served by a long-term care bed or some sort of other long-term nursing healthcare facility. They don't necessarily need to be in an acute care bed, but because you can't move people out of hospitals, they're staying in beds. Because people are staying in the medical and surgical beds, you can't move them up from the emergency room. So you get this domino effect where overcrowding happens because there simply just isn't enough space for everyone.
So what is the solution? What needs to be done now to combat overcrowded ERs and long wait times?
So long term, what we really need is more long-term care beds, because if you can get people out of the acute care beds of the hospital, you can put them in long-term care beds, you can free up space. Here's the thing. It's not a problem when a lot of people show up to the emergency room with minor illnesses. You can deal with that. If it's a case of bronchitis, you write them prescription for antibiotics, it's done. You can see large numbers of patients quickly if you have to. It's just that if you don't have enough space, if you don't have enough beds, if you don't have enough personnel, you just can't process people fast enough. So if we want to disengorge the emergency rooms, the biggest underlying issue is to have more long-term care beds so you can get people out of hospital when they no longer need to be there, so you can move people up from the emergency room to the hospital beds. And then in parallel, you do all the other stuff that we mentioned, which is you have alternative options for people who are not really that sick and don't necessarily need to go to the emergency room. So there's a number of different things that we can do. We just sort of have to decide on an avenue and just pursue that going forward.
All right, Dr. Christopher Labos, epidemiologist and cardiologist, thank you for your time and Happy New Year to you.
Happy New Year to you too.
Thank you.